Hello, everyone. I'm Tony Bernardo, Dean of UCLA Anderson, and I'm delighted to welcome you to the second in a virtual series of conversations we're having with several distinguished speakers. Today, we're honored to be joined by a UCLA colleague, Johnese Spisso, the president of UCLA Healths, CEO of the UCLA hospital system, and associate vice chancellor of UCLA Health Sciences. It's not every day that you get to interview one of your heroes. And the work that Johnese and her team at UCLA Health are doing to protect and care for us is truly heroic. Johnese Spisso is a nationally recognized academic healthcare leader who oversees all the operations of UCLA's hospitals and clinics, as well as the health system's regional outreach strategy. Before coming to UCLA in 2016, she spent 20 years at the UW-Medicine in Seattle, where she was Chief Health System Officer and Vice President of Medical Affairs for the University of Washington. She played a major role there in expanding collaborations with regional hospitals and developing a statewide trauma system. Johnese was trained as a registered nurse, and in 2019, she was named one of the year's top 25 women leaders by Modern Healthcare magazine. Welcome, Johnese.
Thank you.
You know, given everything that's going on with the pandemic and these extraordinary times we're experiencing, we'll have plenty of time to talk about, questions related to that. But before I do, I'd just like to ask, a couple of more personal questions. First, how are you doing? And I hope you're doing well. And secondly, how would you characterize really the extraordinary events over the last couple of months?
Well, thank you, Dean Bernardo, and thank you to the Anderson School for having me here today. It's my pleasure to talk with all of you about the work UCLA Health has been doing in this pandemic. So it definitely has been an unprecedented time for our world, our nation, our state, our city, and our university and our health system. Many of us have been around through other pandemics and epidemics and other disaster situations, but this one has been unique in every way and has challenged us to really look at things differently in every way in order to maintain the health and safety of our public, our patients, and our staff. I'd also like to say, though, it has been a remarkable time of coming together in unique partnerships with our community in order to make sure that we can provide safe and effective care and work together to flatten the curve. So as challenging as it has been, I'll say the moments of inspiration have been remarkable as well.
Thanks. I recall earlier this year, you and I had a conversation here at Anderson, and we were closely monitoring, the evolution of the coronavirus. And I know you were paying particularly close attention to it. And I was just wondering, was there a moment when you realized, was there a moment or a day where you realized this was going to be something different, the scale of it, just when you really got a sense of how extraordinary this might be?
Yes, well, at UCLA Health, we have a very large international program. So we receive patients from other countries, and we're also partnering with other countries on teaching research collaboration. So we have a whole team that really every day has their finger on the pulse, if you will, of what's happening. So we began hearing reports in November, December about some of the issues that were happening, particularly in Wuhan, China. And then we began to really follow some of the things that we were hearing. And again, a lot of that information early on was hard to sort out, but we also were getting updates from the World Health Organization, from the CDC. I think the turning point really came in February when we began to see evidence of the virus in the United States. So different than some of the other epidemics that we've had before with SARS and MERS, that fast rate of transmission, the unknown aspects of the virus at that time, is it airborne? Are we looking at airborne precautions? Is it droplet? Is it enhanced droplet? That began to make us really start planning faster 24/7. So by the end of February here at UCLA Health, we had our full command center up and in operation, and we're really beginning to think through some scenarios. The other challenge that we had is we're a health system that is always running at 100% occupancy. So we quickly had to think about how do we create surge capacity quickly, and what are the steps and some of the more drastic actions that we would need to do?
So when, it's hard for me to even imagine the myriad issues that you would have to deal with, across your many hospitals and so on. But what did you establish as your key priorities, and perhaps tell us a little bit more about this command center and how you marshal really the incredible resources you have, but to tackle a problem that is evolving quickly and where you know that there is going to be substantial needs that you're going to have to address in a short period of time.
Yes, well, it's certainly what has paid off has been our investment in emergency preparedness over the years. We have a very robust command center structure, emergency preparedness planning. We do drills all throughout the year, whether it be an earthquake issue, a cyber attack, those types of things. We have a very solid infrastructure. So when we have an emerging infectious disease, we fall back as a hospital on that command center infrastructure to make sure that we can prepare and respond. In this pandemic, like other emerging infectious disease pandemics, the first paramount are really what I call the 4 S's. So the first S is safety. The second is staffing. The third is supplies. And the fourth is surge capacity. So quickly, we had to assess, number one, what are the precautions that are required to safely and effectively care for these patients? And again, early on in the virus, there was a lot of changing information coming in from World Health, from CDC, from LA County Public Health. So 24/7, we were staying in contact. The second piece is on the staffing. And not only do we have to have sufficient numbers of staff, but staff have to be properly trained to quickly learn how to care for patients with this emerging infectious disease. The right type of personal protective equipment to wear. How do you safely and effectively don or put on the equipment, and take off the equipment? Because those two mechanisms are ways that virus can spread as well. How do we quickly train everyone? The third was related to the supplies. So we all keep a baseline stock of supplies. The first thing was, what type of supplies do we need? What type of surgical masks, N95s, protective gowns, gloves, face shields, and do we have the sufficient quantity of those? One of the things, if you think about how large we are as a system with 4 hospitals, 180 clinics, 25,000 staff, you can go through mass quantities of personal protective equipment very quickly. So what did we have, and how could we quickly start ordering additional equipment at the same time the whole world is trying to get those same supplies? And then the fourth area was surge space. So again, we were 100% occupied in all 4 of our hospitals. How do we quickly start to create some additional beds? We have it in regular disaster planning. We have surge beds where we use conference rooms, hallways, those types of things. But we also needed to take active measures in this pandemic to decant, to get patients out of beds that they were already in. So we quickly worked, and by that second week in March, we were canceling and postponing any elective surgery or any procedure that wasn't really urgent or emergent. The public heard the word elective, but those were really things that were non-urgent emergent. So a lot more than just regular, what you would think of as an elective surgery. And during the time from that second week in March to where we are now, we delayed over 6,000 cases. So a lot of dramatic action to actually free up capacity.
I have a few follow-on questions. There's a lot to unbundle there, but I know when it came to procuring PPE and so on, there was a lot of support from the community, from the Anderson community, from business, from just broadly. We even here at Anderson, we had a tremendous effort among our students, faculty, staff to try and help in any way possible. Can you speak a little bit to this community effort?
I will. I mean, that has really been key to our success. And first of all, let's just start with the amazing talents in the Anderson School. the innovation that came together, working with our team in innovation to, take other supplies and create masks, create face shields, work on the reusable nature of masks and face shields. We also had a lot of great work from the School of Engineering. We had a lot of donations from the community, both the private sector in the community, our philanthropic donors to UCLA Health. They stepped forward, and we had hundreds of thousands of donations of masks secured, gowns, gloves, protective equipment. We still needed to purchase a lot more, and then we also had great support in philanthropy for those purchasing of large quantities of masks. That's an ongoing process because we're using those items on a daily basis, and we're also trying to prepare for a potential surge in the fall. So supply chain is something that we actually look at what we have available every 8 hours and run those really models to say, when are we going to need more?
Another thing you mentioned, delaying 6,000 procedures. Obviously, that has, significant financial consequences for UCLA Health. And then the related issue, how many of those procedures are just delayed to another time so that you can hope to generate some revenue at a future date? And how much do you see sort of behavioral changes that perhaps make people reluctant to go to a hospital, even if they need the help?
We're definitely, let's start with that because that's so important. And we're definitely seeing those behavioral changes. You've all probably read recent articles in the news around across the country. We're seeing less numbers of patients coming into our emergency department with heart attacks, with strokes, with mental health crisis. So we know the virus had nothing to do with reducing the amount of heart attacks and strokes. We know that must be behavioral driven. And we are very concerned because we are now starting to see patients present late for care, people who've had chest pain at home for a week and are now finally coming in for care at a time when they've already had many times irreparable damage to their heart. So we've begun a big education campaign with all the other Los Angeles hospitals, the 6 other large systems, to say we are safe for you to come in for the care that's needed. Hospitals are employing the best infection control standards. We're screening for temperatures at every entry. We have the personal protective equipment because we're worried about that second surge in mortality and morbidity related to delays in care.
And then financially, do you have a sense of how you can perhaps recover some, at least, of the procedures that were delayed, and what sort of impact? Because I know there's a lot of discussion about the short-term financial impacts. Is this something that there's kind of hope that we can recover relatively soon, or do you see this as a more prolonged a set of financial issues?
Yeah, the financial issues have really been at a crisis level. We have never seen this type of rapid reduction in revenue. And at the same time, where we have soaring costs in other areas with having to acquire more supplies, with the cost of having all of our staff here, we reduced capacity by over 50%. So our hospitals that are normally 100% full, we got that capacity down to 50% occupied. Delaying those 6,000 procedures were some of the procedures that have the highest revenue for us as a health system. So we were in March and April losing about $3 to $4 million per day in revenue. That becomes almost impossible to make up on the short term. We have applied for all the federal funding that is available, but to date in federal funding, we received about $54 million. And to give you an idea, in March alone, our revenue reduction was about $140 million. Wow. So those funds will not, sustain us. We, like other hospitals, are rapidly trying to safely and effectively get back to providing our core business of healthcare, for the thousands of people who need that. So we're hoping to make up some of that, but it really, time will tell, because one of the other things, as everyone knows, is even getting everyone back because of the social distancing requirements. Our clinics look completely different. You can't have waiting rooms full of people, right? So the timeliness of getting people back is somewhat protracted.
So, one of the things that we're hearing from government officials in particular, but healthcare experts, to get back to some level of normalcy, and for many of our participants who are students, one of the things they're keenly concerned about is how quickly we'll be able to go back to some kind of in-person instruction. A lot has been talked about how, the availability of testing, quick testing, where we can get the results and monitor quickly, is going to be essential to coming back to some degree of normalcy. Where are we on this at UCLA in particular, in terms of testing capacity and kind of innovations in testing? Early tests, people were talking about, delays of 4, 5, 6 days to get results. Where are we on the state of testing and just how many tests we can do?
Yes, and definitely testing will be our way back to opening up the economy, schools, everything, and we think that's so important. So UCLA Health was fortunate. In March, we were one of the first health systems in California to be able to do our own COVID-19 tests. The first week we started, though, we could only do 40 tests a day because we needed faster machines, we needed more of the reagent and supplies. Our lab medicine has been continuously working on that. We were first in line to get the new FDA released machines that are much faster. And currently we're able to do 1,000 tests a day, and we very soon will be up to 3,000 to 5,000 a day. So those are the PCR testing, again, where we're looking for the antigen. Our lab has also been working on the antibody testing, right? To look at the serology testing to say, can we tell if people have had COVID? Is there any potential immunity? Both of those in combination are really important, as well as all the other research that we're doing. So a lot of research around the vaccine, around convalescent plasma. We were one of the clinical trial sites for remdesivir, and as well as a lot of other clinical studies. So those things all have to work in tandem. One of the things that is unique about this virus is some people have no symptoms and some people are critically ill. What is the difference in that, right? At first we thought it was just pre-existing disease, yet we've seen a lot of other, in New York and other places, and even here, so young healthy people get it as well, and some of those are requiring critical care. So we're trying to learn a lot more about the whole sequelae of the virus as we're treating these patients.
You mentioned remdesivir. What is your sort of, expert view on its efficacy and the potential for other therapeutics?
Yes. I think our team that was involved in the clinical trial felt it definitely had some promise. The clinical trial, I think, as you all know, was halted pretty early because there was some promising information. Now we're all just trying to get as much of the drug as possible because there were restrictions on how it was given out. And not everyone has the quantity that's needed. So we're working rapidly to try to secure that. I think there are other types of trials as well that people are interested in working on. But, the faster we can get an effective treatment, the faster we'll be able to navigate out of this pandemic.
So you mentioned really a couple of times, and I think this is something we're all very concerned about, is the potential of a second wave in the fall that's been discussed really almost from the onset of the crisis. A couple of questions related to that. It seems to me extraordinary that you're managing a current crisis that requires moment-to-moment decisions, but at the same time, you have to be preparing for another wave potentially in just a few months. So I was wondering how you think about that. Having these sort of extraordinary dual challenges to deal with really at the same time? And then second, is there something you learned in your planning and response to this first wave that you think will be extraordinarily helpful for managing the second wave?
Yes, definitely. And I think the good news for the public is we're getting smarter every day about how to address this pandemic. So we feel much better about being able to move into a flu season and know what to do, right? We know how the virus is transmitted. We know the protection that we need to do. We know things like social distancing and locking down does have an effect. So as now we're in this period where we see gradual opening up, we know we can quickly implement those other measures if needed, if we start to see rises. And we're going to be following this. Early on, we didn't have testing. We didn't have the ability to test people. Now we do. And very soon, hopefully, we'll have a fast saliva test that people can get results back in minutes. That will really help us gauge and help us isolate and quarantine people who are asymptomatic in carrying the virus. That's the most critical piece. And we also know that we have really, I think, in general, done a better job of educating the public against prevention of all types of flu, right? People understand the importance of hand washing, of, covering your cough, of social distancing, and that'll help us as we face all types of viruses in the future.
So we've talked a lot about managing the crisis and potentially the second wave, but then there's another set of issues I want to discuss with you, and that is how you see the future of the industry evolving post-crisis. And our last speaker said something very interesting. It was related to the financial services industry, his area of expertise. But what he argued was crises like this tend to accelerate trends that were already occurring. And I'm wondering whether you see things like that happening in the healthcare industry.
We definitely see it in healthcare. And in fact, as our team, as we were planning the reset, one of the things we talked about is let's not forget all these best practices we learned in these pandemics and how we can apply those going forward, because it's taught us that we can do care more efficiently in many ways. For example, while we've all laid the infrastructure for telemedicine and televisits over the years, we typically averaged about 140 televisits a week. Once we hit the pandemic and we said we're moving into telemedicine for primary care for our clinics, we very quickly escalated that number. And in the past month, we've delivered over 100,000 visits by telemedicine and video, right? So this factors in, right? I mentioned earlier, we have 180 clinics in the community. If there is a better way of seeing patients that's faster, safer, more efficient, we really don't need to have people come in person unless they need a hands-on physical exam or a procedure. So when you think about, healthcare planning and the cost of putting bricks and mortar around all those spaces, right? It definitely gives us some opportunity in the future. In addition, we've had large parts of our workforce that are working from home, and we've actually found increased efficiency working from home when people aren't having to do the commute, everything else. So our finance department, our IT services department, they've been really able to keep up with everything by working from home. So we're thinking about that as well as we plan for how much space do we need to be leasing in the future to house staff in. Those two areas, I think, have been really profound and really have profound impacts for healthcare financing going forward.
I want to just dig in a little deeper, particularly on telemedicine. And I'm thinking of an analog here at Anderson, which, we had some experience with remote learning, but a lot of faculty didn't have experience with it. And we tend to have our priors about how well that would work, and students have that priors. And then until you actually try it, you don't realize how effective it can be. Not in every circumstance, obviously, but in a lot of circumstances. I'm wondering whether not only is this crisis in some sense making it clear that we have to have some other way of providing health services, but whether there's really been a sea change in kind of people's perspectives and beliefs about how effective telemedicine can be.
Yes, I think it's forced people to use it, and it's forced them to overcome some of those biases that they initially had. We've seen phenomenal patient satisfaction with it. We've been surveying our patients as well. And just the accessibility of it, the timeliness of it, and because of the tools that are available, it has been interesting. I have noticed that our workforce, our physicians, nurse practitioners, physician assistants, regardless of the age demographic, either if people were really comfortable with using it or not, people felt the quality of the visit and the information gained in the visit was high. So that was really good to see. At first, I thought people would not feel that it was the same. Now, granted, we're still doing a lot of, of the more complicated visits in person, but this has been a dramatic increase. And I honestly don't think that we would have ever moved to this model this fast without a pandemic. It forced our hands.
Right. So, I'd like to ask a few questions around leadership. This is obviously a topic of great importance, managing through crises and just general leadership learnings that we get out of moments, times like this. And I was just wondering how you would describe yourself as a leader and what leadership qualities that you think helped you navigate this crisis.
Yes, definitely. I think my background, working many years as a trauma and critical care nurse in emergency trauma systems, really prepared me to be able to stay calm and collected in disaster situations. I think that's so important because it is a time when staff are uncertain. They're uncertain about their own safety in caring for patients. They're uncertain about, are the supplies going to be there if needed? They're uncertain about what they're taking home to their families. I think as leaders, it's important to be very informative and transparent in sharing with the staff information that but also staying calm, collected, and listening to what their concerns are and addressing those concerns on a daily basis. So one of the main functions of our command center, and we still do it every day, 7 days a week, is preparing the communication for the day. So we have a special 12 p.m. to 1 p.m. call every day where we've heard all the issues, we've looked at what's happened over the past 24 hours, and we put out a brief, succinct communication for the staff, answering all of the questions, giving them links to where to get the information so that we can really stay fluid with that. Particularly in this pandemic, because there was so much unknown at the beginning, we had widespread fear of people caring for patients, and we needed to quickly calm that down. I cannot credit our staff enough for their willingness to work closely with our infection prevention expertise in really designing the best care and the best safety. And we had just so much support for that. And we also, one of the things that we recognize as UCLA, as our campus and as our health system, we have world experts here. So we felt so prepared for the guidance that we were receiving in infectious disease from our team of specialists here. They were really connected 24/7 to everything that was going on around the world and using evidence-based information to guide our practices.
How do you sort of share, we're part of a network of academic institutions, but obviously you have, we were talking just before we came on, you were at the University of Washington before you came here. They were sort of really one of the first to be really hit with the virus really a few weeks or so before it came to California. tell us a little bit about how you communicate with other leaders at other hospitals and healthcare centers, and how you share best practices.
Yes, and networking has been so important in this pandemic, in particular because at different parts of the country, people are seeing different things. And so sharing that information and best practices has been key. So a couple different ways. First of all, through the University of California system, 3 times a week, we have a call with all the CEOs. We have a uniform dashboard that we put out that reports all of our cases, all of our employee exposures, everything. So we all can see what's going on. We also have shared everything from personal protective equipment resources to all of our policies and procedures. Then nationally, we have an organization called Vizient that is the group of academic medical centers, over 120 academic medical centers across the country. Every day we do a listserv update on what's happening. We also shared policies and procedures, looking at how people are really managing that. And then also through Los Angeles County, we have a weekly call with the Hospital Association of Southern California, looking at what's impacting the LA hospitals. There were many other things that we had to do in this pandemic that sound minor, but ended up being major, that impacted our patients, our family, and our families and staff. One of them was around visitation. We very quickly had to restrict visitors, and that may seem like an easy thing to do, but that was one of the most difficult challenges we had. If any of you could imagine having a loved one in one of our hospitals, and you know we care for the sickest of the sick in the region, and to say that loved one can't have visitors, it's frightening for patients and their families. And our staff really were torn emotionally about doing that. We knew we had to really prevent transmission, and we also had to preserve PPE, but these we feel are just fundamental to patient rights. So how do we manage that effectively? That's something we all worked on nationally. And we looked at how do we create certain exceptions. So if someone is delivering a baby, if it's a pediatric patient, if it's a patient at end of life, how do we really safely and effectively allow that? Those things, the camaraderie and that discussion and dialogue, I felt were really important for our staff to work through these.
You know, I think about the extraordinary decisions that your frontline healthcare workers have to make. And I'm just, you know, I think I speak for everybody participating, just how deeply grateful we are to you and really everyone at UCLA Health for really looking after us all. But I'm just wondering, you know, given the extraordinary difficulty of being a frontline healthcare worker at this time, what can you say about their morale, how they're sort of feeling about the work they're doing, the difficult choices they have to make on a day-to-day basis, and at the same time, they've got their own family issues. They might have kids who are out of school that have to be educated, and they might have family members who are vulnerable. Can you tell us a little bit about their morale, how they're feeling, and you know, how they're doing?
You know, I have to say I'm so inspired by that. The morale has been remarkable, and in part thanks to everything that you're all doing to really recognize our healthcare workers. You know, the university doing the blue lights, you know, just brings smiles to everyone's faces. The support and thanks that we've received from the community, the gratefulness from patients and their families. It's really inspired the staff to go that extra mile and confront this pandemic with courage. We've also tried, again, with the outpouring of support we've had, we've tried to use some of those funds to really provide wraparound services. If people need to stay in a hotel, if they're afraid to go home after caring for patients on the COVID units, if they need assistance with childcare. We have huge wellness and well-being resources that we're offering to staff on a daily basis. We've had a great outpouring of funds so that we can provide meals. Randomly, every day, we provide meals at complimentary to our staff in the cafeteria, and that was from really thousands of dollars in donations that we had. We do a nice little, it's a little card. I'll just show it if you can see it. It shows healthcare workers in the superhero costumes. The superheroes are saluting them. And they get one of these on their meal tray to just really express the thanks that we've had. But I'm just so personally grateful to the whole UCLA community for wrapping their arms around our healthcare professionals at this time.
Thank you. I think it's again our deepest gratitude, and any way we can help, please let us know. We're happy to reach out to our community to help you in any way. Thank you.
Thank you.
So we'll go now to some questions from our participants. So a reminder to submit a question. You can go to slido.com and enter the event code 61155. You can either submit your own question, or you might want to upvote a question that is already listed, and we will try to answer at the least some of the most popular questions on the app. So here's an interesting question, because I've thought about this too, and I can't imagine how infuriating it is. But the question is, as a leader and an expert in the field, how do you deal with the situation where government officials broadcast unsound guidance to the public?
That is always a challenge. And what we try to do is continue to reinforce factual information. So we've done a lot of media as well, so that we can share more of our evidence-based guidelines and information for the public. That's so important. And, particularly as the virus was emerging, I think we were all trying to be cautious not to put out too much information that maybe wasn't validated yet.
Here's a question. When you look back, perhaps it could be a few years from now, what do you hope will be the biggest change in how UCLA approaches public health crises? And I'll add to that, what sort of societal issues would you hope would come out of this?
So for UCLA Health, I think we will see an organization that is more prepared and better prepared than ever. These types of tests really help us build resilience. And, we have, in this short period of time, we've developed over 300 additional standard operating procedures that will now be part of our portfolio in a pandemic. As far as for the United States and the world, I think the need to invest in public health, right? We've had a lot of underinvestment in that recently. I think this brings everything front and center again of how important those investments are into safeguarding our society.
So one of the big debates, obviously, that is going on really all around the world is, how do you open up the economy and how do you do it in a staged way? Obviously, we're not only suffering a health crisis, but now we're suffering a huge economic crisis. And the question here is, how do you think about opening up the economy to, say, asymptomatic carriers, or what might be a path forward in terms of opening up the economy?
Yeah, and we know that's so important, right? There'll be a whole wave of secondary effects on health that are related to the collapse of the economy. So we are, as health systems, we're also interested in being a part of really opening back up so that our country can thrive. We would say it's going to be a combination of the testing, the contact tracing, and the effective quarantine when needed. And all of that needs to be able to be done in more of a real-time basis. So that has to be done carefully. We would favor, I think Governor Newsom has put out a good plan of a phased approach. And that approach also looks at what's happening, looking at, is the curve flattening? So we would support that thoughtful approach. I think at every phase of that, though, there is going to be vigilant monitoring to make sure that we aren't seeing the surge.
Do you have any sort of expert opinion on when we might see various milestones around the timing of inexpensive, quick testing, effective therapeutic treatments? And in particular, I think related to this, even if we have access to therapeutic treatments, when would they be broadly accessible? Because clearly there's going to be tremendous demand from all around the world, and really supply can only grow at a relatively modest pace.
You know, those are all the questions I think that we're all asking every day. We have at UCLA Health, we have a whole research hub that we put together around COVID-19. And that group, we are constantly asking, what else do you need? What can we do to support the things in testing? I think it's too early at this point to even really say. I mean, even with remdesivir, you know, can we tell you that every patient benefited from that? We can't really say that. But do we want to have the drug to give patients an option for that? Yes. The same thing is going on with all the discussion around vaccine development, right? And how effective would that be? How soon could we get to the billions of doses that would be needed? It's all too early to tell, but what I will say is we've been really impressed at the remarkable speed that our research community is moving. I'll also say, you know, and I think another organization that usually gets a lot of criticism is the FDA, and we've seen them move at record speed on, you know, approving the new machines for testing, on the work around remdesivir. So I think we're seeing a lot of policy changes that hopefully will allow us to move faster.
Oh, here's a question that we've talked about quite a bit between ourselves, but perhaps it seems that the participants would like to know. Anderson and UCLA Health are prestigious systems. How can we engage in cross-functional collaborations between the two departments to advance the state of healthcare? It's almost like I would have written that question myself.
Well, and again, I think that's so exciting. We are going to need the incredible minds at the Anderson Business School to really help us navigate our way out of this pandemic through innovation, through business planning. So we look forward to having a lot of projects for your students going forward.
Yeah, and I'll say a few things about that too. We have we have a lot of research activity around healthcare analytics, around behavioral biases in the way healthcare providers make decisions, around logistics and supply chain issues, which, as we've seen, are extraordinarily important.
So important.
Yeah, and so we have a lot of research activity, and then from our perspective, I couldn't agree more. One of the advantages, I think, at a place like Anderson is that we can partner with UCLA Health, which is really an asset and set of resources that maybe there are probably no other universities in the world that have access to. So I couldn't agree more with that sentiment. I think there are tremendous opportunities for us to work together and do things that really promote the social mission of the university. Here's a question that goes back to the staff, and I think this is an expression of how many of our participants are concerned about the well-being of your staff and the healthcare personnel. And just when they are dealing with extraordinary stress or trauma, what resources do they have available to deal with this? And I imagine that's quite common.
Yes, and it's been so important, in this pandemic, because we also have had healthcare workers test positive for the virus, and their concerns about their own personal health and well-being, as well as their families. We have a whole wellness team, so we have everything available from critical incident stress debriefing to psychological counseling to mindfulness to meditation. Really any of the therapies that are needed. We're doing yoga, we're doing urban Zen relaxation. So there's a whole portfolio that's accessible to the staff. One of the things too, early on, I was, worried that staff were too busy to even look at accessing that. So we get a weekly report from our wellness team, and I'm pleased to say that staff are pausing and taking that moment to get the help that they need, which is really important.
Here's a question, and we'll maybe take just a couple more questions, but this is a question related to something I think that goes back to the question we asked about trends and whether or not they've been accelerating. And this is around sharing information, sharing patient information. And first, a sort of a general question about where you see the trends in terms of healthcare data and the sharing of healthcare data records. There's been a lot of discussion about how successful that initiative has been. We all kind of recognize that that's a very important initiative, and whether or not this gets sped up in this process. And then would UCLA Health be expanding the My UCLA Health portal to exchange information with other healthcare providers?
Yes, so a couple things on that. I think this will lead to more advances in sharing de-identified data, particularly so that we can really learn more about the patient populations that we've all cared for in this pandemic. And we are always actually looking at ways to continue to refine and update our My UCLA Health app so that we can actually share information as appropriate with patients and providers. So all of those, we've, even during this phase, the amount of IT changes that we've implemented have been pretty significant.
We have a lot of MBA students who are interested in careers in healthcare. In fact, it's one of the fast growing areas of career interest for our students over the last decade. And I'm wondering whether you have some general advice that you might have been applicable before this pandemic, but sort of perhaps other advice looking forward for students who have expertise in management and have interest in healthcare careers. What advice you would give them, and perhaps some insights into some capabilities or qualities that would be most valuable going forward.
Yes, and I think particularly when we look at our economy today and what's happened, I'll just say in general, I think healthcare is one of the really good employers. That is, we're going to be here. We're all taking financial hits right now, but we're open, and we're always going to be open for business. And one of the things that we are going to need is really the innovation that will help us transform healthcare systems into the future. And a lot of that comes from, the skills that you're all learning and developing now. So as we think about where we make future investments for jobs, new types of positions, it will really be geared towards those that are transformational in nature. We know that we can't continue to afford to do business in the same way we have in the past.
Great, thank you. I think we've covered a lot of the questions that were, among the most popular. So I think at this point, Johnese, this has really been a wonderful conversation. I'm just going to, before I close up, let you have a concluding comment or words that perhaps you'd like to convey to all of us, and then I'll close up for this afternoon.
Oh, thank you. Well, it's been my privilege to spend a little time with all of you. I think, the first thing I'll say is just, we need to all continue to be inspired and stay positive. We will get out of this pandemic. We will be better prepared in the future for additional emerging infectious diseases. I think we all can feel really proud of the response of the entire UCLA Health community, as well as Los Angeles and our state of California. When you think about Los Angeles with over 10 million people and the numbers of cases that we've had, we did an amazing job, and we need to thank the community for listening to the directives of shelter in place that really prevented us from being in the situation of New York City. And so one of the things that I'm inspired about is, as we look even to a potential outbreak in the fall, I think we have a resilient population here in Los Angeles and in the state of California that will work with us on the restrictions so that we can keep everyone safe. So thank you.
Well, thank you again, first for this terrific conversation. We learned a lot, and I appreciate that, but also, again, to express on behalf of everyone participating, but really on behalf of the entire community, to express our gratitude, our sincerest gratitude for the tremendous work that you and your team are doing. Thank you for participating, but in particular, thank you for keeping us healthy and safe.
Well, thank you, and I'll pass that thanks on to our staff from the Anderson School, so thank you.
Once again, thank you, Johnese, and thank you all for participating.
Thank you.